A man who earns 1 million, but through that process destroys his health, is really not a success. That means as you move your daily activities, please be mindful of your health. On this note, I welcome you to Healthy Living. My name is Nana Akusiabuachi. Today I have with me here a director of Heart Hospital here in Kumasi, and he is a good health practitioner. We are discussing hernia today. There's a lot to learn from it. There are a lot of misconceptions that we have heard concerning hernia. Hello, Doc.
Hi.
Thank you for joining me. It's been a wonderful moment here in Kumasi. The experience here has been nice. I don't know, how long have you been in Kumasi?
At least 20 years.
20 years?
Yes.
That is so nice. I know. Okay, so this is right inside Sweet Gardens here in Kumasi. We want to say a big thank you to them for accepting us here in their comfort zone. All right, let's go for this quick break. We'll be right back. Welcome back from the break. If you just joined me, my name is Nana Akusiabuachi and it's Healthy Living right here on Hope TV. All right, Doc, we are discussing hernia.
Hernia.
A lot has been heard about hernia. Before we go into it, you know, growing up, I remember I was walking on the street with my mom and I saw this gentleman walking in, sorry to say, a funny way. So I asked my mom, what is wrong with this man? And he said, keep quiet. Let's move a bit ahead. Afterwards, he told me he's suffering from hernia. That is swelling of the testicles. But I realized there is more to it than we know. But before we dig deeper into that side of the story, what at all is hernia?
A hernia. A hernia is what happens when an organ of the body pushes through the structure that covers it. That is at its simplest level. Hernia is a pushing of a structure or an organ of the body through the organ or through the lining that covers it.
Okay.
So it can happen in different parts of the body. A very typical example is the one that you find typically in children. Behind the navel, the umbilicus, there seems to be this hole, and when they are crying or screaming or yelling or straining, you see that it appears to bulge out. That is a hernia, a weakness in the body and structure pushing out of its covering.
All right, so children also suffers from hernia,
Yes.
not only adults.
Yes, anybody can have a hernia.
Okay, all right then. So if I have hernia, what is the symptoms? What will show that I'm having hernia?
All right. As I said, a hernia happens when a structure pushes through its covering. Now, before a hernia happens, before I come to your question, it means that there is a weakness or a gap through which that structure can push. Right, and so what you see when you have a hernia basically is something pushing into a place where nothing should be. And so wherever you have that weakness, it can be in the abdominal wall, can be in the groin, can be in the umbilicus, you see something pushing out, and then that is a hernia. And what will distinguish this from other things that can push out is that typically anything that you do that increases the pressure in the abdomen, so it could be coughing, could be straining, could be lifting, it causes that structure to push out. And then when you have relieved that pressure, it tends to go back in.
Okay.
The very simple example that many of our viewers will be very familiar with is what happens in little children. In Akan, they call it fumetu.
Okay.
There's a hole behind the umbilicus, the navel. And so when this child is crying, yelling, shouting, straining, you find the abdominal contents pushing out through that hole. And immediately the child relaxes, it returns. That is a hernia. And so you can see the same thing happen in various parts of the body. Can be above the navel, it has a fancy name, I won't bore you with it. Can happen in the umbilicus, it can happen in the groin, pushing into the scrotum or the scrotum. You can have a hernia occurring at different parts of the body. If somebody has had, for instance, a surgery, the place is supposed to have healed. But when the person strains or shouts or coughs and something pushes out and is able to return, that is a hernia.
Okay.
Now, a hernia is not an abdominal pain. I've had people before who say, "Oh, I have a hernia." You go so I say, "No, I don't see anything, but it's painful." No, that is not a hernia. To a hernia is not every groin swelling. And I never met the woman, the man your wife,
my
mother and you yourself met.
Okay.
But if I was a betting man, I would bet that probably wasn't even a hernia to start
hernia
with.
at all.
Because many times you confuse all sorts of groin swellings as hernia. But there are different things that can happen in the groin to cause swelling. So if it moves or if it gets bigger when you cough or strain and returns when you stop, it is likely to be a hernia.
Okay.
Now, if it has been moving in and out for some time and at a point moves no more, the fact that it has been moving before means it is likely to be a hernia.
Hernia.
So in summary, when you have a hernia, you see something push out where there shouldn't be a hole, especially when you strain, and it returns towards cavity when you stop straining.
Okay, so with the signs, there wouldn't be something like with malaria, your head, you're feverish, or your temperature rises, or certain things that will signal you that, okay, why don't I go to the hospital to check on this? Is there anything like that?
Okay, so for a hernia, the basic thing you see is something popping out when it shouldn't pop out. That's what you see in a hernia.
Does any part of your body?
Yes.
Is it be in your tummy?
Yes.
Is it
Usually it's the abdominal region, but it can be in the groin. It can even be hidden anywhere inside the body. For instance, where the esophagus, the throat goes through the chest or the diaphragm and meets the stomach, you can actually have something pop up over there.
Okay.
But for now, I would want us to concentrate on the external hernias, the abdomen and then the groin.
All right.
Now, normally, again, I'll use the very regular example of the child with the umbilicus because that is the prototype we can all see. So for as long as it goes in and out freely, all you see is that something is popping up when it shouldn't pop up.
Okay.
And for as long as it is going and coming freely, you would not have any complications. Now the problem comes when it moves out, and because so much of it has moved out, it's unable to move in again into the cavity. So when that happens, then the neck of the cavity holds the part that has popped out. Now the part that is popping out could be part of the intestine, could be part of the fat that covers the intestine, it's called omentum, could even be the testes themselves, could be the ovaries in a woman, could be anything at all. Now when it pops in and is unable to pop out again, then it begins to squeeze the neck of the structure. And so when that happens, it can no longer get blood as it should. So when any structure doesn't get blood as it should, it begins to die.
Yeah, definitely.
And so when that structure begins to die, then you have other signs of hernia. So it is not the hernia itself that is giving you the other signs or symptoms, but it is what has happened to the hernia. And so if, for instance, it pushes through, let's say part of your intestine pushes through the navel or wherever the gap is, and is unable to return. Now you have blood supply cut off to the intestine, and so that part begins to die and rot off. And so what you see will be the signs and symptoms of a rotten intestine, where you have the vomiting, the diarrhea, the fever, but by that time you are very far gone. And so it is important that as soon as anyone sees a bulge where there shouldn't be one, in yourself, in your child, in anybody, it is important, that is the point to seek medical attention. Typically, it is not painful at that point. And so people tend to ignore it. People tend not to seek any help for it until it gets to the point where they can no longer stand it
anymore. All right, so you made mention that most of the time it's just the groin and then the tummy. So what about those ones with the scrotum issue? So
to understand this, you need to talk a bit about how the testes are formed.
Yeah.
Now in the womb, when a male child is developing, the testes are formed in the abdominal cavity, very close to the kidneys. Now, as the child develops in the womb, the testes descend, and usually by birth, they should descend into the scrotum. And so there's a canal, the pathway linking the abdomen to the scrotum. That's how come the testes descend. So that is the normal pathway. Now, what happens is that once something has gone through a hole, if there's a weakness or something else that goes with it, it can also descend through that same hole. So there are different kinds of hernia. You can have it in the femoral canal, which is where the thigh, the vessels of the thigh migrate into the thigh. You can have it in the inguinal, that's a groin canal, where the testes migrate into the scrotum. Now what happens with the kind of hernia that you see descending into the scrotum is that
Yeah.
the intestine or whatever it is follows the same path that the testes followed. And so they can descend into the scrotum. And so that is why it is with men that you see that kind of hernia. Now for women don't have their ovaries descend outside. They are still inside.
No, exactly.
And so that is why women would not tend to have as much of the inguinal hernia. Again, women may have other hernias, like an abdominal hernia and epigastric that's on top of the abdomen, an umbilical, the navel hernia, even a femoral hernia, because they have also the same gap through which the vessels of the thigh descend. But when it comes to the one that descends into the scrotum, it is because it is following the same path that the testes followed when they were in the mother's womb.
In the mother's womb. Okay, so we made mention of men, children, and then women. But let's take children out. The rate between men and women,
Okay.
which both of them have the higher risks of getting hernia?
All right. So when it comes to the inguinal hernia, men have more than women because they have a ready-made weakness where the canal exists.
Already made.
Already-made weakness. But when it comes to the femoral hernia, again, the men tend to have it more than the women. Even though women will have more femoral hernias than than inguinal or groin hernias. Now, like most other things, hernia are the combination of both what we are born with
Okay.
and what you do. So there's the genetic and there's the environmental component. Again, you realize that when there's a weakness and nothing happens to break through the weakness, you are unlikely to have a hernia. But if you already have the weakness and something happens to cause you to strain some more than usual, then it is likely that you would have a hernia. And so men indulge usually in a lot more heavy lifting,
Yeah.
typically a lot more of an active lifestyle. And as men grow, other things come into play. Like for instance, the prostate gets bigger and harder. It begins to squeeze on the urinary pathway, the urethra. And so now they have to strain more to urinate. And so when that happens, then you are generating more pressure in the abdomen. However, when women also get pregnant, they also create more pressure in the abdomen. So if they have the weakness that is likely to lead to hernia, as pregnancy progresses, they may get it breaking out. But in general, men tend to have more hernias than
Okay. So is it is it urgent that when somebody have hernia, the person have to really get treatment as soon as possible, or they have to take time?
All right. So when somebody has a hernia, as I said earlier, for as long as the hernia freely goes and comes, in medicine people say it's reducible. When it comes, you can reduce it.
We'll get that on that.
You are unlikely to have any problem.
Doc, we'll come back on that.
All right.
Viewers, let's go for this quick break. We'll be right back. All right, welcome back from the break. It's hernia we are discussing here on Hope TV, Healthy Living. Doc, you were explaining the fact that I asked that, is it urgent that if someone is having hernia, the person had to rush to the treatment?
Yes, as I was saying, as I said previously, hernia is a bulge where it shouldn't be.
Yeah.
Typically, when it comes and it's not complicated, the person himself or herself is even able to push it back. He's able to reduce the size of the mass. So that's why we say reducible.
Okay. So, particularly at home?
Yes, they can do it.
Do it at home by
Yes.
pushing it back?
Yes, they are able to do that.
Okay.
And that is why typically people don't seek treatment early. The challenge is that the day that it becomes non-reducible, it means it has become complicated. And so structures are at risk of dying. And so whenever you have any indication that you do have a hernia, it is urgent to seek medical advice. Now, the treatment or repair may not be done immediately, but at least it can be planned and done electively at your own pace and convenience. Now, if you wait until it actually traps something, then it becomes an emergency and it becomes a lot more complicated. And so as soon as you see any indication that you have a hernia or something that could even be a hernia, it is appropriate to seek medical intervention, and then a plan can be made for you. Okay. For instance, if there are other conditions that are likely to raise the pressure in your abdomen at the same time as you have the hernia, For instance, you are coughing, because anytime you cough, you generate more pressure in your abdomen.
Yes.
So if you are coughing and you have a hernia, typically we make sure that we deal with the cough
First,
and then we go on to handle the hernia.
Okay.
If you have constipation, for instance, you have to strain at stool.
Yes, exactly.
Again, you have to do something about the constipation to relieve the
First.
pressure before we work on the hernia.
Okay.
If you have some reason that you have to strain to urinate, an elderly man with an enlarged prostate, for instance, you want to take away anything that is likely to cause that increased pressure in the abdomen before you work on the hernia.
Okay.
And so because there may be other things to be looked at before the definite treatment of the hernia, as soon as you see in yourself or in somebody that this person could have a hernia, approach a trained person so that first the diagnosis can even be made and confirmed, and then secondly a plan can be made for dealing with it.
Okay, so that means that when you have hernia, don't try fixing it your own way, pushing it back, or trying to be smart. I'll put it that way. You need treatment. That is very important. All right, doc. So is there any diet? You know, some of these illnesses, we are told, okay, maybe drink this juice, and then as time goes on, you'll be fine. Take this particular diet, and you'll be okay. Is there any diet of such that can prevent, or better still, reduce hernia?
All right. So, first principles, a good balanced diet is good for everybody.
Exactly.
A good plant-based, roughage, inclusive diet is good for everybody. The reason, or one reason, is that it makes it easier for you to free your bowels, and you're unlikely to be constipated and generate more pressure in the abdomen.
Yeah.
So yes, that is found to be very helpful. Even if two people have the tendency to have a hernia, the one who gets constipated often is more likely to actually have a hernia. Now, once a hernia has occurred, it means that there's a break in the covering. And I always liken it to having a torn button. You know, when my button is torn, each time I push out my tummy, it's going to pop out. And each time I push it back, it's going to go. Each time I eat very handsomely, my tummy is likely to pop out through the buttons.
Yes.
Now, until that button is fixed, anything else that I do is not solving the problem.
Okay.
And so, yes, continue to take the balanced diet, continue to eat well, drink a lot of water. All those things are important.
Okay.
But once somebody has a hernia, it has to be repaired. It is a break in the covering of a structure. And so until that break is repaired, that hernia is not going to go anywhere.
All right, so what's the preferred method of treating hernia?
So once a button is torn, you have to fix it.
Exactly. Retread a needle.
Yeah, absolutely. So once there's a break in the body structure,
Yes.
which is allowing other structures below it to pop out, it has to be repaired.
Yeah.
And so it is sad that people prey on the ignorance of people and claim to sell various drugs or medications to solve hernia. As I said, it's not all groin swellings that are hernia. So maybe if it is something else, fine, we can talk about other treatment. But if it actually is a hernia, then it has to be repaired surgically.
So there's nothing like the ones we join the Trotsky and then they go
yes.
like, you know.
You sit in a Trotsky
Yeah,
and these days sometimes information centers at 4 a.m.
Yeah.
You start blaring out the news that they have drugs that can solve hernia and
Hernia.
so on and so forth. The truth is that a hernia is like a torn button. Until you fix it, you haven't repaired it.
So we don't have natural remedies
No.
of healing hernia?
No.
All right. So there is no natural remedies of healing hernia except surgery. Okay. So with surgery, you know, people are scared when it comes to surgery. Is it that scary when we're trying to fix hernia?
The sooner the better. When it is uncomplicated, it is really, in most cases, a simple procedure, depending on where it is. Because basically what you have to do is to open and find where the structure has pushed through, find where the weakness was, see if the structure has undergone any damage. If it has, fix it. If it hasn't, just fix the area of weakness. And that's it.
That's all.
But in the past, a lot of hernia repairs were done. They put the person to sleep. But now, most of the times, you won't even be put to sleep. It is just a local anesthesia. You are talking with your surgeon and the team all
The
through
next
the
thing,
surgery. The next thing,
done.
get up and go. In fact, now, most hernia surgeries are done and the people go home the same day.
Okay.
It is when it gets complicated that it becomes a problem. Because sometimes it is not the hernia itself that is the problem, but the part of the intestine that has been trapped, it has undergone starvation, let me put it that way, because it hasn't had a blood supply, and so some parts
So it's
are
dead and rotten.
So sometimes
off.
you have to cut off some parts of the intestine and join it somewhere. That is when it becomes a complicated surgery. But most hernia cases that are uncomplicated, the repair is also uncomplicated.
It's uncomplicated.
But when it is allowed to complicate, then of course the repair also tends to be a lot more complicated than that.
Okay, so is there any complication after surgery? Or is there any other issue that comes after surgery? You know, people go back home and the next thing is like without the stitches ends up tearing up, or other issues start coming up. Is there any complication of that sort when it comes to hernia after surgery?
Like with every other surgery, factors relating to the patient, the procedure, or anything else can generate complications. But hernia repair done by a professional is one of the surgeries that has the least tendency to complicate. But having said that, if the patient already has some cause of immunosuppression, maybe they are diabetic, they have some other conditions, their healing can delay.
Okay.
Some people react to stitches and drugs, and so they may have infection at the surgical site. Some people may have a recurrence of the hernia. And this is what happens. So the person had a weakness.
All right.
And in addition to the weakness, the person had some factor in their life that allowed that weakness to break out. So they have done the surgery, have repaired the weakness. But that factor hasn't been taken away. Maybe they are still lifting carelessly, or maybe they are still not eating well, so they are having their constipations and all those other things. Maybe they are still coughing.
So those who go to the gym and raise the dumbbells and all that?
Yes, that's why it has to be done under supervision. There's a right way and a wrong way of lifting. There's a way of lifting such that you don't generate more pressure in the abdomen, you use the muscles. And there's a way of lifting such that you generate abdominal pressure that can cause a hernia.
And no matter how you lift dumbbells, definitely there's going to be a pressure.
No, there is. Maybe next time I bring dumbbells, I'll show you how it's done.
Definitely. Probably our viewers will need that.
You need that,
yes,
definitely.
Yeah.
Yeah, so those are some of the complications that can occur. But aside that, most people who have a hernia repair can return to their pre-repair lifestyle after the recovery period. So, like everything else, there may be complications, but hernia is probably one of the most frequently done elective surgeries with the lowest rate of complications. Yes.
All right, so what other things or lifestyle can cause the hernia to come back in someone? Maybe aside, maybe lifting, or maybe not eating. Is there any other thing that can cause it to come back?
So we talked about not eating. Well, let me add that the repair of these structures, all that the surgeon does is to put a suture in to put them together, but the healing is done by the body. And so if the nutrients that you need for good healing are not there, like your protein and some vitamins, collagen and so on and so forth, you are likely not to heal well. If you have other conditions like maybe HIV, diabetes, that reduce your immune system's ability and resilience, then you are also likely to have poor healing and recurrence. Alcohol and tobacco are known to immunosuppress. Definitely. So again, exercise should be done consistently and under supervision, because sometimes we have the intention to exercise, but we don't have the discipline to do it consistently. And so we realize that, hey, it's been a month, I haven't exercised, and in one day we want to do all that we should have done in the past month.
And you know, imagine everything at a go.
When that happens, we are likely to have not just hernias, but other exercise-based injuries. Yes. So those are some of the factors that can cause a recurrence. Of course, when you do have a cough, constipation, problems with urination, seek help quickly, because it's not the one cough that will bring a recurrence. But if you've been coughing consistently for a week or two, then you are consistently weakening the area, and you are likelier to have a breakthrough. Not in the right sense.
Not in the right sense. All right, let's go for this quick break. We'll be right back. Welcome back from the break. It's still Healthy Living on Hope TV, and inside here, Sweet Gardens. Here is a very wonderful place here in Kumasi. A serene environment. As you can see, we're really enjoying the weather. So anytime you visit Kumasi and you want somewhere to reside, then I recommend Sweet Gardens for you. You will never regret it. We are discussing the topic hernia. Dog, so you were actually explaining something. I was laughing about it so much.
I was talking about breakthrough, not in the sense of who wants it.
At all. You know, most of we humans, especially, want the easy way of living.
Yes.
When it comes to certain diseases, with hernia, for instance, we want the quick way of fixing ourselves up as compared to we finding the best way not to even get hernia at the first place. And it's really a big problem to all of us. All right, so with hernia, we know we have different types of hernia. And you've mentioned the common ones, which affect both males, females, and then children. Are there other ones?
Yes, for instance, if somebody has had a surgery and the healing left a weakness, you can have what is called an incisional or a surgical site hernia. Now, you can have, I talked about the epigastric one, the diaphragmatic one. The diaphragm is a sheet that separates the abdomen from the chest.
Okay.
So it lies a sheet of muscle just below the lungs. Now, it is through this sheet of muscle that the esophagus goes to join the stomach. It is through the same one that the vessels that carry air, the trachea, and also blood, the aorta pass. Now, some people have a situation where part of the stomach slips past into the chest cavity. Now, when that happens, that is also a different kind of hernia, but they have typically symptoms that are often interpreted as peptic ulcer because it's like acid coming into the chest. They have heartburns, chest and abdominal pains, and so on and so forth.
So instead of thinking about hernia, you think about ulcer.
You think about ulcer.
Okay, and they start treating themselves with ulcer. Taking ulcer medicines.
And that is why if anybody believes they have something that could be ulcer, in fact, if anybody is treated once, twice, and they still think they have ulcer, it's always best to have an endoscopy done. Now, for an endoscopy, what happens is that a tube is placed through the mouth all the way down to the stomach to see what is actually happening there, whether it is actually an ulcer or could be something else altogether. So that is another kind of hernia that you can have. And apart from that, you can have hernia in the chest wall and so many other places. But having said that, there are other conditions that can cause either a bulge in the chest, the back, the groin, or anywhere else, which are managed differently, have different consequences and different progressions from hernia. So it is always very crucial to know exactly what it is that we are dealing with. For instance, you could have a bit of, there's some fatty layer beneath the skin before you get to the muscles and the bones. Now, sometimes you can have a lump of fat popping up under the skin. It can pop up almost anywhere, chest, back, going anywhere. It is a lump of fat. So fats are lipid, so it's called a lipoma. It's a lump of fat. That tends to be soft. It doesn't disappear and reappear, unlike hernia.
Okay.
You can have other kinds of things that also pop up. The case that you met with your mother so many years back,
of course,
could have been a hernia, true, but it could have been something else like a hydrocele. A hydrocele is when you have an accumulation of fluid around the tunic or the covering of the scrotum. And they can also get really big.
Make you think that it's hernia.
And that is not hernia.
It's not.
You can have things like
even
elephantiasis of the scrotum.
Yeah.
Now, typical elephantiasis we know is the one that gets people's legs to go big.
Of course, yes, swollen.
So that's why they gave it the name elephantiasis. You can have elephantiasis of the scrotum, which can get them really big. You can have so many other things. You can have the blood vessels that supply the testes also becoming big and overloaded with blood. So there are so many kinds of groin swellings. You can even have a swelling of the testes or chitis. So there are so many things. When you see somebody walking in a way you don't expect, don't think only hernia. There can be so many other things that can
exactly. Think about any other thing.
Yes, and that is why it is important that you seek the help of somebody who is trained to tell you what exactly is going on. So that together you can plan what to do about it.
There shouldn't be self-medication on that. Okay, so is hernia genetic? As to, okay, so my relative or my dad, my mom, grandmother, grandfather once had it. So probability of me having it is high.
I will shift the focus from genetic to, do you have a greater chance if it's somebody in your family has it? Yes. The reason I'm shifting from genetic is that, you see, genetic means that you were born with it, you can do nothing about it. But often things that run in families don't only run in families because they were inherited. But sometimes they run in families because typically what you get from your family is both your genes and the lifestyle.
Yeah.
So if you're born to a dad who is an athlete and a mom who is an athlete, chances are that you probably pick up sports.
Definitely.
If you're born to a dad and a mom who are both sedentary, sitting all the time, chances are that that's what you also grow into. And so much as there is a component that you may have been born with, maybe a weakness in the muscle, a weakness of the tissue or something, the fact that we tend to adopt lifestyles, including unhealthy lifestyles of our family members, also plays a part.
I came to meet my mom and my dad living large. Let's join in.
So that is what happens. So it is not just the genetic, as in the genes components. It is nature and nurture. It is the genetics and the environment. So both factors play a part. So if you came to meet a family that is not eating vegetables and is on fast food, and because of that they typically end up constipated diarrhea, chances are that you pick up that lifestyle and you also increase your chances of getting it. If your family lives in a place where there are so many pollutants, and so they are always coughing, chances are that you'll be coughing, not because you are born to cough, but because you are born in an environment that promotes coughing. So those are the things that make it likely that if everybody in your family has had a hernia, you have a greater chance of getting it. It doesn't mean that you definitely get it, but it means that you should be aware
of it. Okay, so how long will it take someone who has undergone the treatment of surgery, okay, I'm going back to work, I'm going back to my normal lifestyle? Because you made mention of the fact that some people can have the hernia today and leave the hospital the same day. Does it mean that if I leave, maybe I had the surgery on Sunday, Tuesday I can just grab my things and go back to work?
Okay, it depends on the work you do. If the work you do is more clerical or something that does not involve actual lifting and heavy activities, those who are doing their own job, sometimes they return the same day. They come for the hernia repair in the morning, and by evening they are in a meeting. Having said that, because it's a surgery, typically there can be some recovery period, but all things being equal, usually by a week you should be good to go. Often a bit of time is given, especially for those who are working for other people, so that they are not overstressed wherever they find themselves working. Because you see, the hernia goes beyond just the hernia. As you said, just the thought of surgery can frighten somebody. Yes. Can destabilize their psyche.
Maybe a friend went through that and didn't come back.
So the recovery period is not just for the cut and sew, but it's for you to get back into the mindset, give the tissues time to heal, and then you can return to your normal activities. However, if it is your normal activities, for instance, you are an orderly or somebody who does a lot of heavy lifting, depending on the location and the size, it might give you up to a month or even 6 weeks to recover, so that the body will regain its strength. Typically, after you have done your hernia repair, if there have been no complications, you can return back to the lifestyle that you were used to. It doesn't limit you in too many ways.
All right, so we're done with the men and then the women. Let's move to children, which is the delicate one, of course. So what at all causes that in kids? Because we know adults, probably our lifestyle, our behavior causes this hernia. But what about kids?
Right, so for kids, you'd have to go back to how the body is formed in the womb. there are so many wonderful things that happen when a child is being formed in the womb.
Of course, that makes God wonderful
That makes
and
you
great.
wonderful,
Of
yes.
course.
And so there's a lot of structure development as that goes on. Now I use the example of the one in the navel because that's the one that is very relatable. For the child in the navel, the child in the womb, sorry, the intestines are formed outside the abdomen and then rotate and go inside the abdomen before the navel seals up. So for some children, by the time they are born, that hole behind the navel hasn't fully sealed. And so a lot of kids are born like that with an umbilical hernia. Now, because they are still developing, for many of them, by the time they are about a year or two, that hole seals or is largely sealed.
Okay, naturally.
Yes. But when beyond the time you expect it to have sealed, it is not fully sealed, then you have to plan and seal it.
Okay.
At the stage when it is still not complicated, because as I said earlier, when it is not complicated, it is simple.
Yeah.
That sounds like a truism.
Of course.
When it is not complicated, it is simple. When you wait for it to become complicated, then it becomes more troublesome. So a lot of things can happen in the process of the child being formed and developing in the womb. That can leave certain weaknesses in some parts of the structure.
All right, so with kids, we know adults go through surgery. Can kids also go through that?
Yes, they can.
And they are safe to go?
Yes, they are.
Of course, because some parents are so scared.
Scared, definitely.
Because even with adults, we're scared to have
Yes,
surgery.
definitely.
And then with kids, the idea of losing a baby is very tough on some parents. So they are okay to
Yes,
also
they
undergo
are.
surgery.
And so typically for children, again, there's always a weight of the risk against the benefit. You wait till they are quite stable enough to undergo the surgery.
Okay.
For as
So
long as it is not causing,
period?
for as long as it is not causing any trouble. You see, that's the
Okay.
thing. If it becomes trapped, then even if it's a month old, you have to go and relieve it.
If it's a month-old baby,
Yes,
so
and the
it doesn't
hernia traps,
matter
yes, and
the
the hernia
age.
traps the intestine,
Okay.
for instance. If you don't release it, that intestine is going to die and the baby is going to die.
Definitely.
Yes, so, but if there's no other complication, most surgeons will wait till the child's about 3 or 4 years when they can comfortably go through the anesthesia, have the surgery done, and also during the recovery period, at least at 3 or 4 years, they are developed enough so you can
Of
talk
course,
to them
of
to
course.
avoid and not avoid certain things.
Certain things. All right, so after surgery, as a parent, what can they do to help that child, especially not to get the hernia coming back again?
Okay. So, again, for prevention, all too often these days, we are not letting our kids develop good muscles.
At all.
Many years back, kids would play football, volleyball, pilolo, jump up and down, ampe.
Your mom will tell you, come back inside and study.
Yes.
Yes, you have to study enough for football and games.
Yes. But now, when even the kids would play, it tends to be computer games and phone games and things like that. And so that doesn't do a lot of good to the development of especially muscular strength and also body strength. Now, a child who has had a hernia repair still needs to exercise, but needs to be guided as to what things they can do so that they develop the strength without complications. Diets, plant-based, plant-dominant, roughage inclusive, water drinking diets.
Enough of the juices.
The juices.
Enough of
now,
the
pure
baguettes.
fruit juices may not be as bad as carbonated drinks. But even they are not ideal. Let them eat the fruit itself.
Okay, so it shouldn't be juice.
No, the
they
fruit
should take
itself.
the fruit
yes,
itself.
take the watermelon, take the pineapple, take the orange. That includes the roughage and everything else.
But I know the fact that taking juices works faster as compared to taking it from the raw source.
Yes, and that is a double-edged sword. You get it faster, but what that does is that it gives the body a big injection of sugar at a time.
Okay.
When you are eating the fruit itself,
It takes a
you
time.
are chewing, it's going
Yeah.
slowly, so the body can
Yeah.
adapt to it. It's like cooking slowly. But when you just take the fruit juice at a time, it's like delivering a shot of sugar quickly to the body. And so they are likely to take more than they should.
Okay.
I mean, can you imagine eating 10 oranges? But if you juice those same 10 oranges, you can drink all the juice and still not be satisfied.
Yeah, it's true.
And so
that is true.
The diet should be such as would give them good bowel movements. You should drink more water and not just juices. You should exercise, keep their body strong. And they shouldn't sit too much television and that kind of thing. Not too much. You should keep active. Because now we are seeing children getting obese earlier.
Yeah, a lot.
And when you are heavier than you should be, the chances of something breaking through are also higher. So yes, keep them safe, but keep them active.
Keep them active.
Keep them eating well. Let them drink the right things.
Parents should stop being paranoid and being scared of their kids stepping out.
We all scrape their knees sometimes.
And being impressed by our parents, you know, it's very true. So yeah, doctor, you need to take good care of your child, but you shouldn't forget that that child needs to be well strengthened with health. That is good for that child. Okay, so Doug, you are the director of Heart Hospital. How many times have such cases come through, both with male, females, and then that of children?
Oh, a lot. Really, we have a lot of them. Until Heart Hospital is just 3 years old.
Okay.
It just started on 1st July 2016. So this is the 3rd year.
Okay.
And we do have quite a number of them.
So you mean you've celebrated your anniversary already?
We are still in the anniversary.
Yeah,
we tend to have quite a number of them. Again, more men than women. But women also tend to have more of the umbilical ones. And then, for instance, those who have undergone some surgery before also tend to come with incisional surgical site hernias and those kinds. Children, yes. For children, usually you pick them at birth or very early in childhood. And then you assess them to see when you need to take an action about them. So yes, we do have quite a number.
So meaning with Heart Hospital, you do your job so well by checking the kids. But is it like that with any other hospital? Let me put it this way, the general way. A hospital is supposed to do that when a child is born. You know, then they check, okay, if the child is a sickle cell, the child has other issues. But aside of this, do they check with hernia?
Yes. Fortunately for hernia, you don't need any fanciful equipment. And so at birth, the child is checked for any abnormalities. Okay. And then when the child returns for the first visit at 2 weeks and again at 6 weeks for the first immunization, they are checked for any of these things. If any of these things are picked, then a plan is made for how to deal with them.
How to deal with them. All right, so parent, you know, that's Heart Hospital. It's an Adventist hospital as well. Okay, so you've been in the system for 3 years. Now let's focus on Heart Hospital. Where is it located?
It's located at Ahinsai on the Lake Road. It's just adjacent to Ahinsai Seventh-day Adventist Church in the former premises of the South Central Ghana Conference of SDA. All
right, so we're proud Adventists. You know, we have a hospital that takes care of those issues. So how has been the experience like for 3 years? Although it's not been long, but how has it been like?
The experience has been a testimony of the leading of God, because we started very small with very big dreams. And God has been faithful. Currently we offer inpatient and outpatient services, specialist services in family medicine and obstetrics and gynecology. We have a dialysis center for chronic kidney disease patients. We run chronic care for hypertension, diabetes, and we are a very lifestyle and family friendly hospital. Again, we intend to begin a dental clinic, and so from the 5th to the 6th of August, we'll be having a free dental screening at the premises. That will be the beginning of our dental hospital. So we are a family-friendly hospital.
Please, the date again.
5th to 6th of August 2019.
All right.
And everybody is invited. Dentistry is something that many of us don't pay attention to until we can't close our mouths anymore.
Exactly.
And so we are inviting everybody to come, because while it's still simple, it's simple.
You're always using that term. All right, so it's simple. Okay, so the rates, as to people coming, the amount, you know, hospitals of today is very expensive. Right. What is it with Heart?
Like, thankfully, about 85% or so of our clients come under various insurance schemes.
Okay, so national health covers some.
Yes, it does.
All right.
It does. And when for some reason there's a service that you need that we don't have or can't provide, we discuss with you, because there are other Adventist hospitals and other hospitals that we have worked through and worked with, and so we, together with the clients, find a way of getting that service rendered.
I hope it's not only Adventist.
Definitely not.
Yeah, we need to clear that one.
Definitely
it's not only Adventist.
Incidentally, people tended to misinterpret the heart as H-E-A-R-T, heart. And so they thought it was only a hospital for heart conditions.
Okay,
But
so it's not heart.
It is H-A-R-T, Hart. It was named after Dr. Richard Hart, the president of Loma Linda University. Right. And so we do everything, everything and anything. And we have family medicine services, so from cradle to grave. To
grave, all right.
Anybody
so you can have that page
yes.
from baby, mommy, daddy.
Everybody. That
range. That is so wonderful with Heart Hospital. And you said the location again?
It's on the Lake Road, Ahinsan. It's next to the Ahinsan SDA Church.
Okay.
It's in the premises, or the old premises of the South Central Ghana Conference of SDA.
And the free dental screening?
Yes, from the 5th to the 6th of August.
Meaning it's 2 days?
Yes, 2 days.
All right.
We have medical missionaries from the Ghana U.S. missions coming to help out with the dental screening. Okay,
so what is Hospital Heart or Adventist Hospital Heart looking forward to in the next 10 years?
In the next 10 years, we want to become the preferred center for all Ghanaians.
All Ghanaians, in fact, cut across every disease.
Absolutely, for comprehensive and coordinated care. You see, typically the challenge tends to be that our healthcare tends to be a bit fragmented. So when you have a problem, when mommy has a problem, she sees the gyno.
Yeah.
When the baby is born, the gyno says, I don't want you anymore, go to the pediatrician.
Yeah.
When the pediatrician takes care of the baby and the baby gets to 15, 16, he says, no, I don't want you anymore, go to the physician. But Heart Hospital is family-centered. And so anybody and everybody at every stage is welcome and invited.
So you don't need to be roaming around,
not at all.
Whereby you have to go do lab somewhere else and then come back. Okay, then that's just wonderful. Okay, so your contact, so in case any viewer wants to come,
yeah. 020 775 4472.
Okay, repeat again.
020 775 4472.
Is that the hospital line?
That is my line.
That is your line. Yes. Okay, what of the hospital line?
I'll make it available at the end.
All right, so viewers, we heard, doctor, that if you want any kind of treatment, you can just visit Heart and then you'll be cured. It's an Adventist hospital. And you know, with us, we deal with the good source and we treat the right way, according to God's will, right?
Yes, definitely.
We thank God for that. All right, so we'll be closing down the curtains very soon on Healthy Living. But then, you've learned a lot with Hernia. You should know that you shouldn't wait till when you think you can't handle it anymore before you visit the hospital. It's about time we humans, especially Ghanaians, change our lifestyle a bit by visiting the hospital on time. In fact, don't wait till you're even sick. At least every 2 months, probably right, every 2 months, try your best to visit the hospital. Don't think, you know, people go to the hospital and they think the smell of the environment, I come back and then I'm sick. So why don't I wait till I fall sick before I go there? Please, it's not true. You have to visit the hospital regularly. Let it be like your second home of treatment. Yes, so that if there's anything hiding in your body, it can be fished out immediately. And if you have hernia, as doctor said, don't try treating it yourself at home with this treatment from people in the Trotsky, with this people trying to advertise their products in one way or the other. The only treatment is surgery, and you should know it's not scary. With God, you're going to survive through and come out healthy and cure. So be assured that you're going to be fine through surgery. Don't try pushing it back yourself. It won't work. Okay, so on this note, I'll say a big thank you to you, my viewer, that you always make time to watch Healthy Living. And to you, Doc, thanks so much for coming.
You're welcome.
And then I know the next time we'll be coming right to Heart.
Definitely.
So that at least our viewers will have the full view. They wouldn't be
the feel of the
just
place.
saying, yes,
Definitely.
yes, don't, you know, doctor just says something this time around. Seeing is believing. I think I mentioned that phrase for you people. You know, Ghanaians, we like to use that phrase. Seeing is believing. So we'll give you the opportunity to have a feel of Heart Hospital very soon. Thank you so much for coming. And also to every other person who supports through, especially Sweet Gardens, for accepting us here. They're inside Kumasi. If you come to Kumasi anytime and you want somewhere to relax, a place to reside, then I recommend Sweet Gardens for you. Never regret it. Then to GTP, we're Clothing Me, and then to Valley Life, and then Ash Foam for always supporting us as well. I'll say a very big thank you. I'll see you same time next week. My name is Nana Akusia Boach. As I always say, stay healthy and stay blessed.